So now I'm going to open it up for questions. And Dr. Yagane, I'm going to start with you. This has been a popular question that we had come in a couple times, and Dr. Kuo touched on this briefly about requiring vaccines in the school setting. So could you tell us a little bit more about if you think high school students will be required to be vaccinated in the fall?
So thank you for asking me that question. I think it's something that has definitely been in the media, and in general, we in the Department of Public Health are not requiring this vaccine while it's under emergency use authorization. It is not yet a licensed vaccine. It is not approved by the FDA. So we would like the FDA to have that opportunity to review all the data over the months that we're collecting data, and then to really investigate it. And then once it's licensed, that might be a possibility. But I don't foresee that happening by fall next year. So at this point, we would not require it. As far as whether individual school districts or individual schools can require it, I think that would be something they would have to discuss with their legal team.
Great, thank you. And of course, many more conversations to be had about that. And I guess I would open up to any one of the three of you for a follow-up question to that regarding vaccines that are currently required in the state of California and how the California Department of Education is involved in that process. Does anyone want to take that question?
Oh, well, vaccines are required in the state of California because of a law that was passed in 2015, SB 277. And that's for school entry for both public and private schools. So at this point, those, I think it's 10 vaccines those are legally required, and school districts have been monitoring that for a while for kindergarten entry, and then again in sixth grade for middle school. But there had been no discussion about COVID-19 and adding that into this, like the flu vaccine is not in there. So it would take like legislative action to mandate legally the COVID-19 vaccine.
Okay. All right, so Dr. Kim, I know Dr. Poe touched on this briefly, but could you tell us a little bit more about how long immunity lasts from the vaccine and kind of the latest findings on that?
Yeah, so that really is an observation still being, the data is being collected on that. Early studies suggested that it might be up to 2 years, but time will tell. I think one of the interesting things about this vaccine platform, at least the messenger RNA platform as well, is that should there be not enough people vaccinated in time and mutants develop, that this vaccine platform can be altered to take care of the mutant. So revaccination might be coming up if we get an ugly variant that starts to create more disease. So we hope it'll be up to 2 years, but I think time will tell. That's where some of the clinical trials are going here too, where they go on for 2 years because we're still measuring antibodies in some of those early individuals.
Great, thanks, Dr. Kim. Dr. Kuo, in clinical trials, have you seen, have teens been reacting differently to the vaccine than adults?
I would invite Dr. Yagane to respond as well. As far as I'm aware, no. Obviously, these clinical trials have just gotten underway in the last couple of months. So, they're still collecting data, but we have not heard of any kind of different response among teenagers compared to adults. In the Pfizer trial that did look at 16 and 17-year-olds they were included, they did not have different responses.
So if I could just tag on to that, like Dr. Kuo said, they enrolled about 2,200 adolescents between 12 to 15 years of age, and they looked at their antibody titers as well as their incidence of having infection. And so 18 in the placebo group had infection and none in the vaccine group for the 12 to 15 years of age group. And they found their side effects were very similar to adults. So it seemed like their antibody response in general was a little bit more robust. In general, the younger you are, the better your immune system is still working. So you're dealing with very relatively healthy individuals at that age group. And just as an update, they did actually submit their information to the FDA for an EUA, for an emergency use authorization. So that is being reviewed. It probably will take several weeks to review, and then we'll find out more about that.
All right, Dr. Yagane, I'm going to stick with you for another question here. You touched briefly at the beginning about the efforts, the school-based efforts to help get students 16 through 18 vaccinated at some of the school sites. Are you able to share where parents would be able to sign their child up for a vaccine through the MyTurn portal?
Yes, so I think you guys in the South Bay and beach cities have done such a wonderful job providing opportunities for individuals to get vaccinated. We definitely are doing a lot of school-based clinics. We find that schools are a trusted resource for a lot of communities, especially those who are hardest hit and have the least access to vaccines. Additionally, any of the pharmacies that are offering Pfizer would be an opportunity to get your child vaccinated. Our megapods are all offering Pfizer as well. So if you want to do a drive-through site at one of the megapods, you can start making appointments at those sites. So basically anywhere that has Pfizer, which includes most city sites, most county sites, and a lot of our community clinics and our community partners. But I really do love the idea of a school-based clinic, because it's hopefully not only the child who's getting vaccinated, but their entire family, and you're really creating herd immunity in the school community.
Thank you so much. And I know we have many of our partners through the educator vaccination efforts. We were able to administer nearly 6,000 doses in collaboration with the Los Angeles County Department of Public Health. So some of our school partners from our South Bay Consortium for School Vaccines are included on the call here tonight. So we will be communicating directly with school districts to provide additional access at both our Adventureplex clinic location as well as some of the school locations in the greater South Bay. So look for more information from your school district regarding that. I know some have already started to communicate about that as we gear up for eligibility for all in Los Angeles County tomorrow. All right, so Dr. Cole, question for you. A couple questions came in about fertility and the future effects. So from what we know now, can mRNA affect fertility for future generations, and how has this been tested?
Right. So no, there is no effect on from this virus or from this vaccine, the mRNA vaccine of Pfizer and Moderna, on fertility. This question has come up a lot. I think again that RNA DNA concept makes people nervous. In the original trials, they did not enroll pregnant women, but people got pregnant during the trial. So clearly fertility was not affected. And so obviously they're still collecting data and they're watching it very closely, but from a mechanism perspective, there is not a mechanism in which this virus could potentially cause fertility for either men or women. It comes up that we've had questions from both men and women asking this.
Great, thank you. All right, Dr. Kim, question for you, and you touched on this briefly. Why is Pfizer monitoring the children in the study for 2 years for side effects? What do they think possible side effects could be based on the known science?
Well, both of these, the messenger RNA platform, we're really not expecting any side effects other than the local side effects that we see immediately after the injection. But we continue to monitor, and it's part of the clinical trial, not only for ongoing side effects, which we don't expect to see any, but also for the immune response. That's the way the clinical trial is set up. Dr. Yagana might say more about that.
No, I completely agree with Dr. Kim. It's a combination of, just an abundance of caution. Obviously, we want to make sure we don't suspect that there will be any long-term side effects, but that's what the FDA requires. We have a very stringent requirement by the FDA. We want to make sure all vaccines are 100% safe. And then also because we want to get more information about immunogenicity and how well your body is able to maintain that antibody response over time.
Great. I'm going to stick with you for another question. If my teen is behind in physical maturity and they're a late bloomer for an average 16-year-old, is it still okay to get them vaccinated?
I would think that this is something you could discuss with your pediatrician. Based on what I'm hearing, I would feel comfortable vaccinating that individual.
Great. And a similar question for you, Dr. Kuo. Will there be a difference in the dosage amount for 12 to 15-year-olds versus 16 plus in the Pfizer vaccine?
So they're still studying that, and we don't know for sure. But in other vaccines, yes, there are usually pediatric doses compared to adult doses. So we would it would be reasonable to think that, but when the data come out with the actual dosing, then we'll know for sure.
I might just add a little something that I know the Pfizer trials were testing 10 micrograms, 20 and 30 in the children in the pediatric group. So they are following that data very carefully. You'll know that the adults, at least Pfizer, we get 0.3 mLs or 30 micrograms. So it's being looked at.
Great, thank you. Dr. Yagane, once my child is vaccinated, will he or she be able to interact with others in a more normal manner?
I think Dr. Kuo mentioned this in her presentation. We really are so grateful for vaccines. It seems like you're protected not only from death and hospitalizations, but also from asymptomatic disease. And it seems like based on the evidence we've seen so far, even if you do get infected, it seems like you're less likely to transmit infection. And that's, again, being followed closely. So we'll have more data on it. But I would say that, vaccines are a really crucial element preventing transmission, and hopefully that it will lead us to a more normal situation for all of us.
Okay, now a question for you, Dr. Kim. How do we help teens who have friends who oppose the vaccine? How do we help them understand that the vaccine is safe and critical?
That's a really good question. And it comes up in my practice where parents have gotten vaccinated, but a 20-year-old daughter is reluctant. And really, it boils down to education. I think there's been, unfortunately, the development of a bit of some vaccine hesitancy. Some of it comes from inappropriate data, which really, these vaccines are so very safe. So I think if we can just explain to the individual that has some reservation how the vaccine works, as Dr. Kuo pointed out, it's really amazing. And the rigorous scrutiny that's been given to all these vaccines, they are safe, they are effective, they will protect someone, and they will protect your family and friends. So we just have to convince that shy individual that the science is behind them. So really, it's lack of education.
Great. Anything else, Dr. Kuo or Dr. Yagane, that you'd like to add? Convincing those who might be on the fence, especially for their teenagers as they're newly eligible tomorrow to be vaccinated?
I mean, I think that it's natural to have some anxiety. Every parent is doing the best for their child, and I can't presume to know what goes into each individual's decision. I will say though that again, life has been very difficult during the pandemic for most people, and again, in the hospital we have seen many deaths, and it's caused a pretty big toll on those of us who have cared for patients. And so I think that again, we can only convey that the possibility and the promise of a vaccine is actually amazing, and this first step in being able to end this pandemic. And so again, I would just encourage everyone to think about it, and to understand that the FDA would not approve something that was not safe. And even with this J&J pause, I think it's a testimonial to the safety regulations that we have in place, that 6 individuals who did not live in the same area but reported these similar incidents was able to just pause all across the country very quickly, to just allow more data collection. I mean, this is the way that science works. This is how we create new things, and we learn new things. And so I think again, it's balancing the challenges that we've all faced for the last 14 months with this pandemic, and taking a step towards ending it.
Great. A question, Dr. Ugana. Did you have one more thing to add, Dr. Ugana?
No, I think everyone said it well. And the only thing I would make is the observation I've seen is a lot of people are hesitant initially, but as more individuals in their lives get vaccinated, then that makes them feel more comfortable going. I think it's one thing to hear doctors tell you that it's safe, it's effective, but having community members and people who maybe you see more often, interact more often, tell you that they got the vaccine, it was safe, it was effective, it sometimes helps. So I would encourage everyone to share that with who's been vaccinated, share that with your friends and your colleagues and family members.
Okay, and one more question for you, Dr. Ugane. I know Dr. Koch touched on this briefly, the difference between getting that natural immunity and having teenagers potentially be exposed to COVID and recover. Can you tell us a little bit more about that herd immunity and why it would be important for all who are able to be vaccinated to take that opportunity?
Yeah, so I think there's two parts to the question. So we are vaccinating children because they are getting infected with COVID, and it's not a completely benign disease. So we've had over 3 million children infected with COVID, and we know that we've had over 250 deaths. So this is not something that, it does affect children less than adults, but it can affect children. And even if you don't die, there's morbidity, there's other things, long COVID that we do see in teenage children. I think it's very important for people to realize that by vaccinating their child, they're protecting their child from a potentially dangerous disease. So outside of herd immunity, which I think is more of a public health concept, if we don't get, children under 18 make up about 20 to 25% of our population in LA County. So if we leave that group unvaccinated, it's going to be really hard for us to have enough vaccinated people to really break transmission events. And we are seeing a lot more outbreaks currently this week than we have in the prior weeks, because people are going back to their regular life. They want to play sports. They want to join their dance teams. They want to do baseball, basketball, football. And we want people to do that, obviously. And we want them to be safe. And vaccine can really keep individuals safe who are doing these activities. So there's two different things I would think about: herd immunity, but also really protecting your child.
May I add a little something to that as well? And that is that, to get this pandemic over with, you have to prevent people from getting infected, because the virus has a propensity to want to mutate. And it really can't mutate if it can't replicate, and it can't replicate if it can't get into a human being. So the more of us that get vaccinated, the better. It doesn't give the virus the opportunity to mutate and then get a more virulent form that we're starting all over again.
Thank you. Thanks, Dr. Kim. So Dr. Cole, one more question from the chat for you. Is the vaccine safe for teens with type 1 diabetes?
Yes. So type 1, in fact, patients with diabetes were prioritized for vaccine because they have worse outcomes when they get COVID-19 vaccine, the COVID-19 infection or the disease. Type 1 diabetes, type 2 diabetes, any cardiovascular conditions. On the CDC website, there's actually a list of about 20 or 30 priority conditions that should have been prioritized way back, in phase 1B for the vaccine. And so definitely, if you have type 1 diabetes or your child has type 1 diabetes, they should receive the vaccine.
Great. Thank you so much. And we are nearly out of time. So I want to thank all three of our experts for sharing information about the COVID-19 vaccine and the new eligibility. I think I want to take a moment to just pause. We're on the cusp of everybody in LA County 16 plus being able to be vaccinated tomorrow. So that's a really exciting day for all in public health and all in the community. So I just want to give our three panelists a chance to give one final tip, piece of advice, or hope for the future before we end this evening. I'll turn it to Dr. Kim first. I'll go to Dr. Kuo. Well,
I finally got it unmuted. My finger was stuck. Sorry. No, I want to say this has been what a year, and we're right there. You know, we're just coming up on the finish line. If we can just continue to vaccinate and social distance and wash our hands, this could be a really good 2021. But we're not quite there yet. We really have to still be careful.
Dr. Kuo.
Yeah, thank you. I just wanted to give a shout out to Beach Cities Health District. And, I've given almost a dozen of these types of presentations to teachers and community members and families. And I think that we're very fortunate in the South Bay to have this extra sort of layer and source of information in addition to Dr. Yagane and the Department of Public Health for LA County. And I think that it's really important to go to your trusted sources of information when you're trying to make this very, very important decision of whether or not to vaccinate your children. I too would encourage it, but I know it's a personal decision and a hard decision for a lot of families. But I would just encourage you to go to trusted sources of information.
Dr. Yagane, to close things out.
Thanks so much. I think that one thing I've learned about COVID-19 is it's really important to make partners in the community. And one of the most amazing partners we've had in LA County has been Beach Cities Health District, and also the schools, the churches, the individuals who really have volunteered all their time and efforts, like Dr. Kuo and Dr. Kim, who created these vaccine opportunities and vaccine clinics. I just feel like this is the silver lining of this entire pandemic, is recognizing that we have these amazing resources in our community, and that we could all work together to really, emerge from these devastating public health, disasters, and really just seeing the other side of it and being able to breathe and recognize that there might be a more quick return to normal for all of us. So again, thanks for everyone in the community for Beach Cities, as well as you, Ali, and Dr. Kim and Dr. Kuo.
Thank you all, and thank you again to our experts. We really appreciate you sharing your expertise. For those who weren't able to join us this evening, we did record tonight's presentation, so we will be sharing that with our school partners. And we also will be continuing to update an FAQ document that we'll also be sharing. I know a lot of information, as you heard, is updated on a daily basis, and so we will continue to communicate with everyone as more opportunities for vaccination become available. And again, I reiterate what our experts just said, to go to those trusted sources of information as you make these health decisions. So thank you all for your time tonight. Thank you for taking time to learn a little bit more. And again, thank you again to our experts for sharing a lot of really fantastic information. Have a good night, everybody.